Hi, my name is Lisa Klein, and I'm a physical therapist for over 30 years. So when I was in college, I was actually going to be a dentist, which is kind of hilarious now. But I had a roommate who had Harrington rods in her back, and she owed her life and the fact that she could walk to the surgeon, but also the physical therapist who had rehabbed her. And I had never heard of physical therapy. And to me, that kind of sounded more interesting than being a dentist because I like people and working with people. So I pivoted to physical therapy school. And I went to physical therapy school in the University of Maryland at Baltimore, which was a great program. And I loved the anatomy and the physiology and the mechanics that I was learning. But the thought that I had when I was in PT school was something that really stuck with me, was that it felt like we were teaching people how to be okay with what was wrong with them. And there was no emphasis on fixing. And in retrospect, maybe I should have gone to to be an osteopath, but whatever. I was in PT school, and again, all the background information was fantastic, but I really wanted to focus more on fixing. And the thought that I had in my mind was, we can put a man on the moon, but we can't help or fix a kid with cerebral palsy. That to me was just like, what are we doing with our resources here? This is ridiculous. And so when I was in physical therapy school, a woman named Sharon Weiselfish, who became Sharon Weiselfish G. Mateo, was publishing case studies of doing manual therapy on neuropediatrics. And I was totally impressed with her. I was already interested in learning, cranial sacral and all these things that were more hands-on techniques, although I didn't do that until a few years later. But I knew there was something out there that might be more interesting for me. Kind of my personal backstory is I had a brother who died of a brain tumor when he was a baby, and I was like two and a half. And they say that sometimes these early memories kind of imprint on you. And the running line that became kind of the family lore was that the doctor said there was nothing they could do. And obviously this devastated my parents, and I can't even imagine. But to me, and I'm just kind of projecting here, but I kind of feel like that kind of stuck with me as like, that's not okay. Like, you never have nothing you can do. My intention here with doing this course series is to encapsulate what have I learned to help people save time in terms of how do you turn a patient around quickly and safely, and how do you work with your patients who are very challenging. And we are beyond excited to be doing this finally. This has been several years in the making. And we're very happy to be presenting to you this course series. And we hope you enjoy it, and we hope it helps you with your patients, and we hope that you can help people get better faster.